12 Signs of Hormonal Imbalance in Women. Have you ever felt out of sync with your own body, tired, moody, or struggling with weight despite doing everything right? These aren't just quirks of aging. They could be your hormones trying to get your attention. For millions of women, hormonal imbalances are a hidden battle. PMS alone affects up to 80% of women, bringing mood swings, fatigue, bloating, and more, often dismissed as just stress or part of life. But here's the truth. These signs matter, and ignoring them can lead to serious health issues like infertility, diabetes, or even heart disease. It's time to take charge. Recognizing these signals early isn't just about feeling better, it's about living better. Let's uncover how to listen to your body and regain control over your health. Let's start with one of the most common signs: unexplained weight changes. Hormones like insulin, cortisol, and thyroid hormones are critical for regulating your metabolism. And when they're out of balance, your body's weight management system can go haywire. If your thyroid is underactive, a condition known as hypothyroidism, it means your metabolism slows down, causing unexplained weight gain despite no changes to your diet. You might feel frustrated, wondering why your weight keeps creeping up, even when you're eating healthy. On the flip side, hyperthyroidism, an overactive thyroid, can trigger the opposite effect: sudden weight loss and a constant feeling of hunger. It's like your body can't keep up with its fuel demands, leaving you both exhausted and confused. Then there's cortisol, often referred to as the stress hormone. When you're under chronic stress, your cortisol levels stay elevated, encouraging your body to hold on to fat, especially around the abdomen. This stubborn belly fat is often a result of your body's fight or flight response gone haywire. Not only does this affect your waistline, but high cortisol levels can also lead to insulin resistance. This condition makes it harder for your body to regulate blood sugar, increasing the risk of type 2 diabetes. Managing stress and balancing these hormones can be vital to maintaining a healthy weight and feeling energized. Next up is persistent fatigue. When we talk about fatigue, we're not just referring to the tiredness that comes after a busy day. This is the kind of exhaustion that lingers, no matter how much rest you get. Your hormones play a massive role in regulating your energy levels, and when they're out of sync, it can leave you feeling drained and unmotivated. For example, low thyroid hormone levels, as seen in hypothyroidism, can slow down your metabolism, making you feel sluggish and constantly tired. This can leave you feeling like no amount of sleep is enough, and everyday tasks seem like a challenge. Fluctuating estrogen levels, especially during perimenopause, can also be a significant culprit. As estrogen levels drop, it can disrupt your sleep patterns, making it harder for you to stay asleep through the night and wake up feeling refreshed. This leads to a vicious cycle of exhaustion, as poor sleep further disrupts your hormone balance. If you find yourself dragging through the day, unable to shake off that constant tiredness, it could be a sign that your hormones are out of balance. It's essential to listen to your body. This persistent fatigue might be the key to understanding what's really going on behind the scenes. Irregular periods are another key sign that something may be off with your hormones. Think of your menstrual cycle as your body's hormonal report card. When everything is functioning normally, it stays on track. But when your hormones are out of balance, irregularities like missed periods, heavy bleeding, or spotting can occur. These fluctuations can be linked to imbalances in estrogen, progesterone, or even androgens, hormones typically associated with male characteristics, but also present in women in smaller amounts. One of the most common causes of irregular periods is polycystic ovary syndrome, or PCOS, a condition where high androgen levels disrupt ovulation, leading to irregular or missed periods. PCOS affects around 10% of women of reproductive age and is often accompanied by symptoms like weight gain, acne, and excess facial hair. While it's a common condition, Many women don't realize that early detection and lifestyle changes, such as maintaining a balanced diet and exercising regularly, can help manage symptoms and even prevent more severe complications like infertility. If you notice any changes to your cycle, it's crucial to address them early and get the proper support. Your menstrual health is a reflection of your overall hormonal balance, and taking proactive steps can help restore harmony in your body. If you've been battling acne that seems to pop up no matter what you try, especially along your jawline, it could be a sign of hormonal imbalance. Androgens, such as testosterone, play a significant role in regulating oil production in your skin. When these hormones are out of balance, they can trigger an overproduction of oil, which can clog pores and lead to stubborn breakouts, especially in areas like your chin and jawline. This is a common issue for women with polycystic ovary syndrome, PCOS, a condition characterized by high androgen levels. Women with PCOS often experience acne alongside other symptoms, like irregular periods and excess hair growth. But hormonal fluctuations aren't limited to PCOS. Hormones also shift throughout your menstrual cycle, especially around ovulation and menstruation, which can bring on breakouts. The key to managing this type of acne goes beyond using topical treatments like creams or cleansers. While these products can help reduce surface-level inflammation, addressing the hormonal triggers is essential for long-term improvement. Balancing your hormones through diet, stress management, and, when necessary, medical treatments can significantly improve your skin. Understanding the root cause of your acne can lead to clearer skin, not just for the short term, but as part of your overall hormonal health. Mood swings and anxiety might seem like everyday stressors, but when they become frequent and intense, they could be a sign of hormonal imbalance. Estrogen and progesterone are the primary hormones responsible for regulating your mood. When these hormones fluctuate, especially during periods like perimenopause or menstruation, it can cause emotional shifts that feel out of control. These hormones influence neurotransmitters like serotonin, the feel-good chemical in your brain that helps stabilize mood. When estrogen levels drop, serotonin production can also decrease, leading to feelings of irritability, anxiety, and even depression. Low estrogen levels, which are common during menopause, have been specifically linked to increased anxiety and mood disturbances. Many women report heightened feelings of nervousness, sadness, or emotional instability during this time. But these symptoms don't just happen during menopause. Fluctuations in estrogen and progesterone can affect your emotions at any age, mainly if you're dealing with conditions like PCOS or during the premenstrual phase of your cycle. The good news is that stabilizing your hormones can significantly improve your emotional well-being. Managing stress, eating a balanced diet, regular exercise, and, if necessary, hormone therapy or supplements can all help regulate these hormonal fluctuations and restore emotional balance. Next, hot flashes and night sweats are often considered the classic signs of menopause, but they can also occur during perimenopause, the transitional period leading up to menopause. These symptoms are directly linked to fluctuating estrogen levels, which disrupt your body's ability to regulate temperature. Estrogen plays a crucial role in controlling the hypothalamus, the part of your brain responsible for regulating body temperature. When estrogen levels drop, the hypothalamus can become more sensitive, triggering hot flashes that cause sudden bursts of heat, sweating, and discomfort. Night sweats, a form of hot flashes that occur during sleep, can be particularly troublesome. They can wake you up in the middle of the night, leaving you drenched in sweat and struggling to get back to sleep. The constant cycle of waking up overheated and then feeling chilled can severely impact your ability to get restful, uninterrupted sleep, which, in turn, affects your overall quality of life. Though familiar, these symptoms are not just an inconvenience. they can cause significant distress and interfere with daily activities. The good news is that there are natural and medical options to manage these hot flashes and night sweats. Lifestyle changes, like staying cool at night, reducing stress, and maintaining a healthy diet, as well as targeted treatments like hormone replacement therapy, can help reduce the frequency and severity of these symptoms. Hair loss or thinning is a sign many women overlook, but it's often linked to hormonal imbalances. Androgens, such as testosterone, are typically associated with male characteristics, but they also play a role in women's health. When androgen levels rise, due to conditions like polycystic ovary syndrome, PCOS, they can shrink hair follicles, leading to thinning hair and even hair loss, especially around the temples and the crown of the head. These imbalances can disrupt the natural growth cycle of your hair, leaving it thinner and weaker over time. Thyroid disorders, both underactive, hypothyroidism, and overactive, hyperthyroidism, are also common culprits behind hair issues. An underactive thyroid can slow down your metabolism, affecting the health of your hair follicles and leading to hair loss, while hyperthyroidism can cause hair to become brittle, dry, and sparse. Additionally, thyroid imbalances can alter the texture and volume of your hair, making it feel flat or lifeless. If you find your hairbrush fuller than usual or notice more hair in the drain, it's important to pay attention to these signs. Hair loss can be a reflection of internal hormonal imbalances, and addressing these imbalances through lifestyle changes or medical treatment can help restore hair growth and improve hair health. Digestive issues like bloating, diarrhea, or constipation may not immediately seem connected to hormonal imbalances, but they often go hand in hand. Estrogen and progesterone, two essential hormones involved in the menstrual cycle, can significantly influence gut motility and the balance of good bacteria in your digestive system. These hormones help regulate the smooth muscle contractions in your intestines, which control how food moves through your digestive tract. When estrogen and progesterone levels fluctuate, such as during the menstrual cycle or menopause, it can disrupt this delicate balance, leading to symptoms like bloating, cramping, and irregular bowel movements. For many women, these hormonal fluctuations mimic symptoms of irritable bowel syndrome, IBS, a common digestive disorder characterized by abdominal pain, bloating, and either diarrhea or constipation. In fact, studies have shown that women with IBS are more likely to experience hormonal imbalances, particularly during menstruation or menopause. The connection between hormones and gut health is complex, but it's clear that when hormones are out of balance, your digestive system can be one of the first places to show signs of distress. If you're experiencing digestive issues that seem to worsen at specific points in your cycle, it may be time to consider how hormonal imbalances are affecting your gut. Low libido is often a sensitive topic for many women, yet it's an essential indicator of hormonal imbalance that shouldn't be ignored. Testosterone and estrogen are both vital hormones that play a crucial role in regulating sexual desire. While testosterone is more commonly associated with men, women also need this hormone to maintain a healthy libido. When testosterone levels drop, whether due to aging, stress, or hormonal disorders like PCOS, it can lead to a decrease in physical desire. Imbalances in these hormones can not only reduce physical drive, but also diminish the emotional connection to intimacy. Estrogen plays a part in emotional well-being, and when it drops, many women report feeling less interested in sexual activity or even disconnected from their partners. For women going through menopause, this can be incredibly frustrating as the combination of fluctuating hormones and symptoms, like hot flashes or vaginal dryness, makes intimacy feel less enjoyable. If you're experiencing a drop in libido, it's worth looking into your hormonal health. Addressing the imbalance through lifestyle changes, stress reduction, or hormone therapy can help restore your drive and emotional connection to intimacy. improving your overall sense of well-being. Chronic headaches or migraines, especially those that seem to follow a regular cyclical pattern, could be more than just a headache. They can be a sign of hormonal fluctuations. Estrogen, in particular, plays a significant role in triggering migraines. During periods of hormonal change, such as before or during menstruation, estrogen levels can fluctuate dramatically. This drop in estrogen can cause blood vessels in the brain to expand, leading to a migraine. For many women, these hormonal triggers result in headaches that recur each month, often in sync with their menstrual cycle. Understanding the connection between hormones and migraines is critical to managing and preventing the pain. When estrogen levels drop, it can disrupt the delicate balance in your brain's blood flow and neurotransmitter activity, which is thought to contribute to the onset of migraines. In fact, studies show that up to 60% of women who experience migraines have a hormonal component, with many reporting that their migraines are more intense or frequent around their period, pregnancy, or menopause. Recognizing the patterns and triggers related to hormonal changes can help you manage these headaches more effectively. Unexplained muscle weakness or joint pain can be linked to hormonal imbalances, with cortisol and thyroid hormones playing critical roles in muscle maintenance and repair. Cortisol, often referred to as the stress hormone, is essential for regulating the body's response to stress and maintaining energy. However, chronic elevation of cortisol due to prolonged stress can contribute to muscle breakdown. This process, known as catabolism, can lead to muscle weakness, fatigue, and persistent pain, even after rest. High cortisol levels also increase inflammation in the body, which can affect joints, leading to stiffness and discomfort. Thyroid hormones, such as thyroxine, T4, and triiodothyronin, T3, regulate metabolism and support muscle repair and growth. When thyroid function is low, as in hypothyroidism, the body's ability to repair muscle tissue slows down. This can result in muscle weakness, joint pain, and inflammation. With insufficient thyroid hormones, muscle fibers may not rebuild as efficiently, leaving them more susceptible to injury and discomfort. Additionally, the decreased metabolic rate associated with hypothyroidism can exacerbate feelings of fatigue, making it harder to recover from even mild physical activity. Chronic imbalances in cortisol or thyroid hormones can lead to persistent muscle and joint issues, affecting overall mobility and strength. Finally, sleep disturbances, such as insomnia or waking up multiple times during the night, are often linked to hormonal imbalances. Hormones like melatonin, estrogen, and progesterone play critical roles in regulating the body's sleep-wake cycle. Melatonin, usually called the sleep hormone, helps signal to the body when it's time to wind down and sleep. When melatonin levels are disrupted, often due to stress or aging, sleep can become erratic, leaving you feeling restless and unable to get a whole night's rest. Estrogen and progesterone, which fluctuate throughout the menstrual cycle and during menopause, also significantly impact sleep quality. Low estrogen levels, common during menopause, can cause hot flashes and night sweats, which disrupt sleep. Meanwhile, low progesterone levels can make it harder to fall asleep, as progesterone has a calming effect on the brain and helps promote restful sleep. These hormonal shifts can cause restless nights, leading to grogginess, irritability, and difficulty concentrating during the day. When hormonal imbalances interfere with sleep, it's not just about feeling tired, it affects overall well-being. Sleep disruptions can impact mood, cognitive function, and immune health. Restoring hormonal balance through lifestyle changes or medical interventions can help improve sleep quality and restore energy during the day. By understanding these signs and the underlying hormonal mechanisms, you can truly take control of your health. The incredible thing is that your body is constantly sending you signals through these symptoms, and by tuning in, you can address imbalances before they escalate into more severe issues. A shocking fact: Studies have shown that up to 80% of women experience some form of hormonal imbalance in their lifetime, yet many don't seek help until the symptoms become unmanageable. The good news is that by taking proactive steps, like adjusting your diet, managing stress, and getting regular exercise, you can not only relieve your symptoms, but also prevent future complications. Remember, hormones influence almost every aspect of your life, from mood to metabolism to sleep, so it's essential to listen to your body. Early intervention is critical to restoring balance and living a healthier, more vibrant life. So don't wait for things to spiral out of control. Take charge of your health now and keep those hormones in check. Thank you so much for watching. I hope you found this information helpful and empowering. If you're ready to start your journey toward better hormonal health, don't forget to like, subscribe, and share this video with anyone who might benefit. Take care and see you in the next one.